Good morning. I am Michelle Aletto, Chief Program and Services Officer at the Texas Health and Human Services Commission. I'm honored to join you all as we celebrate the one-year anniversary of the 988 Lifeline. This lifeline has impacted thousands of lives. 988 is truly a lifeline for those in their darkest moments experiencing deep crisis. With continued investments from our legislature and our federal partners, we're committed to expanding and improving the crisis care continuum. Texas has emphasized the importance of mental health by increasing the array of treatment services where and when they are needed. In May 2023 alone, Texas answered over 11,500 calls. That averages roughly 371 calls per day. This is 371 individuals who need support and care during truly critical times, and I am grateful that 988 provides that crucial lifeline. I am also incredibly proud of everyone involved in this effort to connect people with the health and support during a mental health, substance use, or suicide crisis. This work saves lives. I would like to personally thank our staff, our 988 call centers, our first responders, and our federal partners. We couldn't have done this without you, and you should be so proud of the work that you do every day. Thank you. I'd now like to introduce Monica Johnson. Monica is the director of the 988 and Behavioral Health Crisis Coordinating Office at HHS's Substance Abuse and Mental Health Services Administration, the federal agency that oversees the 988 hotline. Monica?
Thank you. Thank you, Michelle. Thank you for having us here today. I am so honored and so proud to demonstrate what this work looks like between federal and state partnerships. Nearly a year ago, SAMHSA transitioned to the 988 Suicide and Crisis Lifeline, a 3-digit, easy-to-remember number to reach the previously known National Suicide Prevention Lifeline. That lifeline, which has existed since 2005, had been long underfunded and under-resourced. However, significant investments from the federal government, nearly $1 billion in recent years, has helped to prepare for the transition to 988, with much of that investment going directly to states and to hire crisis counselors and build local capacity. More than $10 million of that money has gone to the state of Texas so far. Additional funding is coming to continue to support 988 and their crisis care system. SAMHSA has recently announced more than $200 million in new funding opportunities for the 988 Lifeline, and we are awarded funds for the expansion and enhancement of mobile crisis response teams, including 2 in the state of Texas. SAMHSA is also funding certified community behavioral health clinics and provides crisis care-related funds within community mental health services block grants, which are also very critical components to supporting your local crisis care systems. SAMHSA has a very bold vision for the future of crisis care for people with mental health and substance use conditions, with the 988 Lifeline as a starting point. We believe that everyone experiencing a crisis should have someone to talk to, someone to respond, and a safe place to go for help. So with that being said, let me tell you a little bit about what brings us here to Austin today. This visit is a part of a series of events that we're holding across the country to mark the upcoming one-year anniversary of the 988 Lifeline and highlight the excellent work being done across this country to implement 988 and build out comprehensive and robust mental health and substance use crisis care. Texas has a no wrong door approach to accessing behavioral health crisis, follows SAMHSA's national guidelines for behavioral health crisis care. You all should be very proud. From mobile crisis outreach teams, respite care, to extended observation units, private psychiatric beds, mental health urgent care, 24/7 crisis helplines, and outpatient competency restoration. Texas has clearly spent years building out a continuum of crisis care. In Austin and Travis County, long-standing relationships between first responders, city and county elected officials, and Integral Care, the local mental health authority, help to ensure that people in Austin and Travis County have multiple access points to varying levels of mental health care, thus improving health outcomes and reducing unnecessary use of jail, ERs, and inpatient hospitalization. This is a model worth shining a light on for the rest of the country to see. You all should applaud that. Our nation's behavioral health crisis care systems are in a transformational moment. There is no time that I can remember in my career of over 2 decades where I know that every state and U.S. territory is talking about how we access behavioral health services, particularly when experiencing a crisis. We know that we still have a lot of work to do, but I cannot be more proud of what I have seen today and what I know has been accomplished thus far. Thank you so much. And with that, I will turn it over to Tia Dole.
This is a little high. My name is Tia Dole. I'm the Chief 988 Officer for Vibrant Emotional Health. And Vibrant is the administrator of 988, meaning that we are the coordinating body around 210 crisis centers across the country. And some highlights that I'd like to make is that there are 14,000 calls every month being answered in Texas. It's an amazing achievement. The answer rate has more than tripled. But across the country, 988 has served more than 4 million people since its inception in July. That is a huge number of people. Our answer rate has decreased from 140 seconds to 35 seconds, also a huge achievement. One of the things I'd like to highlight as our role for 988 is that our job here is to provide technical infrastructure, to promote public awareness, to provide crisis centers and hence the people they are serving with tools for safety. And one of the big features of our work is really focusing on quality in evaluation, ensuring that every single person who calls receives the right level of care at the right time and that they feel seen and heard, right? Affirming care so that they feel like, okay, that was a good experience, right? That's part of our job. And the other thing is we provide technical assistance to crisis centers across the country and here in Texas, which is specifically how do we work with workforce planning? How do we help with staff burnout? How do we help crisis centers serve communities, their own communities, serve their neighbors to the best of their ability. So thank you so much for inviting us here. We're really excited to partner with SAMHSA and our community-based partners here in Texas, and really seeing that there is a focus on mental health that has never been seen before, as Monica stated, and that we know that we can partner together to help address what is essentially the mental health crisis in the United States. I'm going to pass it over to Dawn.
I don't have the short issue, so I'll just move this out of the way a little bit. Good afternoon. My name is Dawn Handley. I'm the Chief Operations Officer for Integral Care. We're the local mental health authority serving Austin and Travis County, and we provide support to children and adults who are living with a mental illness, a substance use disorder, and intellectual and developmental disabilities. We provide an array of services from a 24/7 crisis hotline to a mobile response team, to outpatient psychiatric clinic care, case management, counseling, and housing. And we've been doing that work for our community since 1967. Integral Care has been a part of the National Suicide Prevention Lifeline Network since 2012. We've worked very closely with HHSC, with SAMHSA, with Vibrant on expanding our capacity and preparing for the migration to 988. So when someone dials 988 from one of the 76 counties that Integral Care supports, they'll get a member of our team. And last year, 97% of the calls that we did take from 988, we actually were able to resolve on the phone with the caller at that time. If callers call outside of Austin or Travis County, then what we'll do is connect them back to their local mental health authority in the county that they're calling from. To give you an idea of some of the things that we can do if they're calling from Austin and Travis County, we can connect them right to an outpatient mental health clinic appointment right then and there if that's what they're calling for. If there's more of a crisis need and they need an urgent in-person response, we'll dispatch our mobile teams, or we can connect them to our psychiatric emergency services, our urgent care clinic at that time, and they can see clinicians after the time of the call. So for almost 10 years, Integral Care has collaborated with first responders, so our EMS and law enforcement teams, in working with individuals with a mental health crisis who value the importance of getting the right care out at the right place and the right time for individuals. This, you heard earlier, will impact and reduce the amount of interaction with the criminal justice system. It also helps the emergency departments by decreasing individuals going to the EDs for a mental health crisis. And it can prevent those more acute inpatient hospitalizations as well. People recover quicker and have better outcomes in a least restricted level of care, and providing an opportunity for them to resolve that crisis in the community where they're from is very powerful. In addition to co-responding in the community with first responders and providing hands-on mental health training for all of their staff, so EMS, all the cadets, police, we're providing them with that mental health background so they know when to call. They can dispatch us out into the field as well if they're on a call. One thing I want to make sure that I lift up and let the community know is that we have mental health clinicians, which are Integral Care staff, on the floor of our 911 call center here in Austin. We are the first municipality in the country to provide the fourth option. So if you call 911 here, your choices will be fire, EMS, law enforcement, or mental health. And then you'll get our clinician and we can connect you to that system of care. In May of this year, our 911 call center hit 10,000 mental health calls. That's how many we've already taken since we've been doing this work. And we're very proud to be a part of that and to be at the table with our first responders. Thanks to these longstanding collaborations built on trust, a shared commitment to improving mental health, and a robust crisis continuum, our community has multiple access points for mental health care, whether they call 988, 911, or your local 24/7 helpline. Thank you.
Are there any questions for the podium? The folks up here will be available for one-on-ones afterwards, but we can take questions from the podium.
So how do you know, I'm Nicole from the Statesman, how do you know what the follow-up is like? How do you know, I mean, I know you give them, you connect them to care, but then what does the follow-up look like?
That's an excellent question, and because we are part of the crisis continuum for mental health response here, we have access right to an electronic health record, so we can see what teams are dispatched to what calls. And our mobile crisis outreach team, part of their work is not just going out on that call and being one and done. They can provide up to a 90-day follow-up with individuals to make sure they're connected to outpatient care if that's what they want, or back to another provider. So there's a twofold, right? A stabilization in the moment and time to resolve that crisis, and then making sure we're doing a handoff to that ongoing care so that they can remain stable. Did that answer your question?
And have you seen more calls now that it's 988 versus calling what you guys were before, which was the suicide prevention?
Right, our call volume has actually increased by like 50%. So 988 is definitely doing several things. One, it's an easy number for people to remember to access care so we can get care quicker, right? And so it's also helping reduce the stigma. So we'll normalize the need for a good and full continuum for crisis response for individuals who are having a mental health crisis, not unlike if you were having a medical crisis, right? And you get EMS. So our call volume has gone up because people are more aware. And so the more we talk about it, the more that volume will go. And where we'll have to focus on as a community and as a state is really building out that continuum of care. So we have that outpatient capacity to be able to allow people to come into services, and that our crisis response team is to scale so that we can go out on all the calls that we need to, that we can take all the calls at the 911 call center that come in, because we're not actually to scale. We're 24/7, but the volume just locally even is higher than we have staff to cover.
I've got a question, and I don't know if you can answer this, but the increase in call volume that you're seeing, is it showing also just an increase in the need for your services?
Yeah, thank you for asking that. I think so. I think that's exactly right. Unfortunately, I talked a little bit about stigma, and I think that does get in the way. People often feel shame talking about having any signs or symptoms of a mental illness, or don't know who to talk to. And then we have different populations of people that have a different viewpoint about, mental health and how it should or shouldn't be addressed. And so, yes, having them come through the front door, if you will, through a call center, a hotline call, or a 988 call, will impact those outpatient services and the need for that. And in a state that's really suffering from hiring providers, right? So we have a doctor shortage, so that's a concern. Licensed therapists are difficult to hire right now. The pandemic really took a bite out of many of the licensed professions, and it makes it a little bit difficult. So I think that's one of the things we have to watch and prepare for as we build capacity so that we're able to be there for people when they need us.
So you had said that Austin is, in our integral care is something that we should be very proud of. Can you go more into why? Why
Sure.
it's working here so well?
Sure. The collaborations and the partnerships here between at a state level, local, county, provider, it's phenomenal. I get to see a lot of different, I know how this works. I came from a community setting, and so I understand the system. And you don't often see this level of collaboration getting the actual outcomes that they seem to be getting here. And so the reference to the 911 Press 4 option, that's pretty unique, and that stands out. And so what seems to really be important here is that they've taken the concept of no wrong door and operationalized it. Like, it's a catchphrase that people often use about systems, but they've actually figured out some ways to operationalize that. And so that is a standout, and that does make, I think, here unique.
What could we improve on here? It's gonna be a question for anyone.
I love your question to her about our integral care. That really warms my heart, and I am so glad you see us that way, because we see you that way. It's our community, and we are so blessed to be here and work in this space. So things we could do better are just really focusing on that capacity and skills training. And when we talk about mental health care, we're talking about, in this instance, people in a mental health crisis. You also have a workforce that you have to support and bring themselves to the table, who will also often have some of those issues as well, right? The pandemic really scared and stressed us all out, and I think we're still trying to recover from that. And the healthcare industry in and of itself lost a lot of really strong and good providers, so we're trying to build back from that. One of the things that we did to really expand on this collaboration is, I like to tell this story, it was over pancakes. You think, you've got big systems, law enforcement and criminal justice is a big system. Hospitals and healthcare is a big system. Mental health care is also a big system, not quite as big, but a big system. And trying to integrate all of that work is really difficult. So when we met to talk about this, well, how can we get as far upstream as possible instead of just catching people after an inpatient admission, right? After they've already had a crisis episode. Because what we want to work towards is building out the outpatient services so people stay stable and they don't need to use those crisis services. That'd be the best case scenario. And so we had that conversation actually at a local restaurant here in town over pancakes, because food makes everything better. And it gets you to open your mind a little bit about what is possible instead of no. But I got to tell you, we heard some no's at first, right? No, we can't do that. That can't be done. Hadn't been done anywhere. Who can do that? We can't. We have HIPAA concerns. We have criminal justice concerns, and how do you get that together? So what's really neat about us is you have your local mental health authority at the table with the first responders. We all have electronic health records. We can look into our system. We can see where people have touched the system throughout in all of those aspects, and really build a plan to expand our services in the areas where we see we're responding the most.
What, ideally, how many crisis responders, phone crisis responders would you have, and how many do you have?
Oh, excellent question. I think we have, right now we're seeing about 50,000. I'm looking at my team. Nicole, why don't you come up here? Let me introduce you to Nicole. She runs our actual hotline and crisis service area in the 988 work, and she can answer those detailed questions.
Yes. I was asking, like, how many hotline responders do you have versus how many ideally would you need?
Oh, So currently, we have 50 staff, 50 positions, frontline staff. I mean, ideally, more. Any one more, two more, anything more that we can get is always great, because what that means is more access to callers. That means more people answering those phones.
So I think we have like about a 84% answer rate right now, right? So if you were trying to get to 100, 20% increase in that area, looking at capacity and having callers available to take those additional calls.
Somebody else can answer.
No other questions? Do you have any others?
What do you guys do to support your staff? Because it could be serious.
Well, this week we'll be doing snow cones, so, and rainbow ones, because, it's the month for that. So, yeah, so we do these get-togethers, and so building the culture in your team is really important. So I get to stand up here and talk about all the wonderful work we do. I'm not doing the work. Our staff are doing the work, and they're phenomenal, by the way, and they are very skilled, and they're fantastic, and we love them. So we want to be able to support them in any way we can. So a number of things we've done is really evaluated salaries, right? One way to stay competitive, because we've got, several hospitals here, and we're all competing for the same staff, is to boost those salaries. So in our crisis area, we added a crisis stipend, not unlike you might see in emergency departments, right, compared to hospital staff. And our robust leave time for people to be out and growing in those areas. But the snow cones and the cookies and we allow them to take mental health days, right? So part of your sick leave and part of your time is really valuing and taking care of your mental health as well.
All right, I think we're gonna wrap it. The folks up here are gonna be available for one-on-ones. You all have met a lot of the call center staff and been able to interview them and film them. There are fact sheets here. If you haven't seen, please grab one with additional information. Thank you all so much for coming. We really appreciate your time and your attention here today. Thank you. Thank you, everyone.
Thank you.